In downtown Little Rock, this is Capitol View.
And good Sunday morning to you. Welcome into Capitol View. I'm Jay Bir. We're back, and it feels good to be back. What's not good right now is the hospital situation across the state of Arkansas. Obviously, COVID having much to do with that. Here to kind of help us get a little bit of a snapshot of what's going on right now is the president and CEO of the Arkansas Hospital Association, Ryall. Bo, we certainly do appreciate the time. How have you been?
It's a busy time, Jay, as you know.
Absolutely. Let's kind of get into some of those busy times here. You know, I know the numbers are constantly changing for hospitals across the state, but even last week, I mean, we are seeing dire numbers. I believe at one point, 25 individual ICU units across the state. To me, that's kind of mind-boggling. You know, what's just the situation like? And again, I know it's because these numbers sort of tend to ebb and flow a lot, but overall, what's the picture look like?
Well, Jay, hospitals are full. They're completely at capacity from what we're hearing from our hospitals. People are waiting in the emergency room to be seen by doctors. So it is a full capacity situation. Right now, we've got 1,234 hospitalized with COVID, which is a bit under our January peak. We've got 462 in the ICU and 254 on ventilators. Both of those surpass our peak in January. So we're at an emergency situation here, no doubt about it.
And we've heard from several other leaders, even nurses themselves, that the problem isn't necessarily the physical space. It's that staffed space is what the real issue is. Is that right?
That's correct. It's staffed beds. So we're in a crunch now for nurses, healthcare workers of all kinds, but particularly nurses, ICU nurses. So we have some bed capacity out there that we could open up. We just need the staff to staff those. And it is a very competitive market, as you could imagine. We're competing with each other. We're competing with other state hospitals in other states. We're competing with the travel nurse industry, which is coming in and offering our nurses higher pay to move on and be in the travel nurse industry. And also we're trying to compete in that industry to get travel nurses into Arkansas to be able to staff those beds. So the price has certainly gone up, which is very challenging for every hospital.
Now this was even an issue when it comes to nursing and staffing, even before the pandemic, and it just seems like now that the pandemic has sort of exacerbated the issue.
That's exactly right. It has exacerbated the issue. There's been ebbs and flows and nursing shortages for years, but what we've seen lately is nurses getting out of the field. We've seen taking other jobs because of the stressful situation. Certainly after the first couple of waves of the pandemic, it's a very stressful situation. Some have chosen to retire early and go to other jobs.
Yeah, and you kind of hit that on my next question here. I mean, I don't know if you guys have numbers, but anecdotally, we've been hearing that, you know, a lot of nurses, you know, kind of in that mid-career, you know, 10, 15 years that they've been doing this are just starting to throw their hands up and they're walking out. And many of them, this is a very female-dominated industry, and obviously, you know, there's still those typical gender roles in society. I'm not saying that that's necessarily always the case, but they tend to be the ones that stay home when kids get sick. And obviously, as we're dealing with a lot of the schooling issues that we've seen, at least over there in Marion for sure, they seem to be the ones that stay home. They seem to be the ones that want to stay home, and it kind of further dips into your workforce.
Sure. There's a lot of situations where, as you said, where there's kids are out of school last year. Hospitals work to set up daycares in some situations. I know the Little Rock School District set up a daycare to help out. But it's a challenging situation, and I think one of the reasons that nurses are leaving the industry is it's hard to be empathetic in these situations when this could have been avoidable. It is avoidable if people would get vaccinated.
Yeah, and I guess kind of go into that a little bit. I mean, how much of this is sort of that mental stress, and a lot of times, and we're seeing the numbers, you know, over 95% unvaccinated are a lot of the folks that are in these dire situations. And you know, as compassionate as a lot of these folks are, as you said, a lot of them have hit a breaking point where they're just, I can't deal with this anymore.
We hear that from every CEO we talk to. It's an emotional impact that's going around. Nurses who have to deal with this every day, the heartbreaking situation of someone coming in who is regretful that they did not get vaccinated, and it's just so heart-wrenching to be able to go through this with patient after patient that they're seeing. So, yes, it is gut-wrenching.
And I guess, too, you know, we've known about the staffing shortages for a long time. And as you said, it kind of ebbs and flows. But is there anything that anybody is doing that's a little outside the box to try to attract somebody? Or does it really just come down to, and a lot of times, just dollars and cents?
I think they've tried a lot of different things through the years, but right now we're in a financial situation. It is requiring a higher rate of pay to attract nurses. So we've seen it go up 47% here in the last 2 to 3 weeks. So the travel nurse industry is just on a straight trajectory going up as far as rates, and we have to find a way to compete with that. And so the Arkansas Hospital Association put together an application to the American Rescue Fund Act Steering Committee here in the state to try to access that pool of federal dollars that the state has. And the Legislative Council is going to hear that next week, but it's for $129 million that could be spread out to hospitals across the state to give them the tools that they need financially to attract and retain the nurses that they have. We have to be competitive in this, or we're going to get even further behind.
And about how many traveling nurses are in the system now, and kind of how does that process work, just for our viewers?
Well, it's hard to say how many are in the system right now. Hospitals contract with travel agencies, and they recruit the nurses, and they go from an 8-week to a 13-week contract, so it's a commitment there to bring them in. And so it's like I said, it's a very competitive market, and there are a lot of them out there, but they are recruiting as much as we're trying to recruit through them.
And also, too, I know the state of emergency that the governor issued a couple of weeks ago that was ratified by the General Assembly, so that is fully into place here. What are some of those strings that, as part of that, have been sort of loosened up a little bit to maybe help with some of those staffing issues?
Well, I think it's with the State Board of Nursing in particular. So nurses that are just at the end of their education or end of their certification, we're able to go ahead and put them in the workforce and bring them in to train them and have them in a part of our workforce. So that's one of the biggest things that helps us out at this point in time through that.
And I guess finally here, Bo, a lot of people I'm sure have reached out or do so in some form or fashion, but what can just regular Joes like myself do, if anything, to kind of help the cause out, whether it be volunteering, things of that nature?
Well, I think it's going to be hard because of the restrictions, COVID restrictions going in hospitals, volunteering, but I think encouraging vaccination is the best thing. I hear people say, is it too late to get vaccinated? No, it is not too late. Even though it will take you a period of time to get your second vaccination and be fully vaccinated, that protection you need, and you need to go ahead and get it.
It is dire straits, but you guys are hanging through it, and we certainly do appreciate all the work that you do and all of our nurses and doctors across the state do as well. President and CEO of the Arkansas Hospital Association, Bo Ryall. Boss, we certainly do appreciate the time.
Thank you, Jay.
All right. Well, coming up after a quick break, we check in on the never-ending debate on infrastructure on Capitol Hill. Jesse Tenur hops on from the Hill. You're watching Capitol View on Sunday morning.
Crazy games, but we're going to play.
Sorry, but that was pretty funny, hon.
Family Game Fight premieres tonight on NBC.
After 7 seasons,
no more stakeouts, midnight calls when you've had a breakthrough in a case.
they're back for one last ride.
Jake, are you crying?
Yes. Brooklyn Nine-Nine, the final season, premieres Thursday on NBC.
A solid golf swing has to start with your feet. But my foot pain got to the point where I didn't even want to play golf anymore. I tried a lot of things and nothing worked. And I saw a commercial for the Good Feet store and I decided to give it a shot. Now with the arch supports, I can focus on my golf game and forget about my feet. I'm Sabrina, and that's my Good Feet story. There we go, that's right on it.
See for yourself with a free personalized arch support fitting at the Good Feet store.
It was a dark intersection. He was just a teenager, but it's a time he would never forget. The screeching tires, a vehicle crushed beyond recognition, waking up in the hospital seriously injured and lucky to be alive. But that young man survived his horrible accident and against the odds found the strength to recover. It was Brad Hendricks, founder of the Brad Hendricks Law Firm.
We're ready for your challenge. We're ready for your call. Right now, you're probably not thinking about your fireplace. It's hot outside, but at A1 Chimney Pro, we know in a month or two when it cools down, you'll need it in good working order. So don't wait. Make sure it's clean and safe for your family right now. Get it done before your neighbors all pick up the phone. Be the first one to have your chimney inspected, cleaned, and repaired if needed by our certified professionals. So it'll be ready when you are. Don't play with fire. Call today or check us out on the web at a1chimneypro.com.
Meteorologist Pat Walker, weekday mornings on KARK4 Today. You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back into Capitol View. Well, the scene is always popping in D.C., so we got to find somebody who is popping to get us up to speed on things. Joining us now here, the one, the only, our Washington correspondent, Jesse Tsunor. Jesse, it's been a minute here. You've ducked me the last few times, but it's glad that we got you back in here.
Yes, what an introduction. Glad to be back on the show, Jay. Thanks.
Absolutely. So let's kind of get into it here. Obviously, the one big thing that's still on everybody's mind is infrastructure. Where do we kind of stand on these things right now? Because it seems like we sort of had a deal. We kind of didn't have a deal. There's a couple of things at hand here. Kind of where are we at?
Yeah, when you talk to people in Washington, they'll tell you that this was a great example of the Senate being very Senate-y. So for months now, there's been negotiations back and forth in a bipartisan way, to note, with the White House and Congress, and they were able to come together on this nearly $1 trillion traditional infrastructure plan that includes everything from funding for roads to highways, broadband, the electric grid, things of that nature, $550 billion in new spending even. And then when the process started actually playing out, there was, of course, nearly a dozen amendments brought forward, different stall tactics, things of that nature. And so definitely what you typically see in the Senate when things this massive are trying to be pushed through. And so, yeah, moving forward, they can argue that, you know, this really impacts all Americans. It's something that's been needed for some time. Usually when it comes to infrastructure, Congress can come together in a bipartisan way, but the pay-fors have really been the major point of contention. But they were able to kind of smooth all of that over, even though there was a lot of procedural hurdles, things of that nature at play as well.
I wouldn't be Congress without some procedural hurdles. I guess, too, you know, where are we at with the reconciliation in this? Because I know Speaker Pelosi pretty adamant in the early stages of this whole thing that we're not going to have one without the other, which, you know, kind of why not just put them in one bill. But, you know, kind of what are things on that? Are we kind of working through some of the minutia on that stuff?
Yeah, that's still being worked through as well, because there's these two tracks now to infrastructure. So there's that traditional one that I just talked about, and then the one that you're talking about, the one that's being called human infrastructure, that $3.5 trillion investment in social programs and climate measures. And so when Democrats were trying to figure out a way to get these priorities of President Biden through, they looked at it as doing that larger budget resolution so they could go the reconciliation route, since they knew that Republicans wouldn't be able to support these measures moving forward, again, because of the money. That's where there was kind of this standstill on the $1 trillion traditional infrastructure plan, because the Congressional Budget Office finally put out a projection and said that there would be more than $250 billion added to the deficit because of that legislation. And so you could imagine if Republicans aren't okay with $250 billion, they're not going to be okay with an extra $3.5 trillion.
That's quite a stark difference here. Also, too, I know some of the Arkansas delegation has been kind of chirping about the effects of all this stuff on agriculture down here. Kind of, you know, what are they seeing? What are they saying when in those regards?
Yeah, going back to different pay-fors, the White House has floated different things to pay for its priorities, including different changes to the tax code. And Republicans, Senator John Boozman has been one of the lead people on this when it comes to spreading awareness about the impact it could have on agriculture, was saying that some of the changes could hurt farmers in the way that they pass down land to generations to come. And so moving forward, forward. The White House has said that there would be carve-outs, that it wouldn't have this devastating impact when you inherit land. But Republicans, like Bozeman, continue to fight for these changes to be taken out because they keep pointing to this research that was done by Texas A&M saying that farmers would essentially lose out on, you know, hundreds of thousands of dollars because, or even more, because of these changes.
All right, obviously the other big thing, COVID still around. Obviously school coming up for a lot of states, especially here in Arkansas. We're going to get into more of that specifically here, but on the national level, when it comes to COVID in schools, you know, what are the recommendations? What are some of the plans that we're seeing, at least at the national level, when it comes to this?
Yeah, the Department of Education this past week released this roadmap of sorts, as they called it, which was kind of this all-encompassing effort to make sure that students, their teachers, and staff were all comfortable returning to the classroom. And it did stop shy of a mask mandate per se, but I would call it a very strong mask recommendation. There was different public mental health measures in there as well. Also recommendations for bringing in local physicians to have conversations with students and their families about any reservations they may have about the vaccines. And one of the most major things is creating these pop-up vaccine clinics in essentially every district in the country to make sure more and more kids get vaccinated. Right now, of course, if you're younger than 12, you can't be vaccinated yet. Recent data shows that less than a third of those 12 to 15 that can be vaccinated still have only received about one shot, so that's still a lot less than what the White House is hoping for. And so there's definitely a huge effort as schools start up again to try to mitigate the spread, not only within school districts, but in the surrounding communities as well.
All roads lead to D.C., and there she is leading the way. Jessie Tenor, our Washington correspondent. Ma'am, we certainly do appreciate the time and the updates, but we shall do it again soon.
You bet. Thanks for having me back, Jay.
You bet. And we've got much more from the special session this past week, plus all the other political news that we've had this week. You're watching Capitol View on Sunday morning.
They used to call me Sir Sauce back in the day.
I knew you was going to claim
Sir
that.
Sauce a lot. You know.
Will is the sauciest
guy they know. Well, when I used to date your auntie, she said I was saucy.
Sonic Crave Cheeseburger. You a saucy cat, man.
Injured? Let's talk about getting help now. Anywhere in the state, dial 8. Whether injured at night, on a weekend, or a holiday, anywhere in the state, dial 8. 888-8888. Let me say that again. Any place, anytime, anywhere in Arkansas, anywhere in the state, just dial 8. We're local lawyers, and it's a local number. Injured? Anywhere in the state, dial 8.
Middleton repairs and replaces more air conditioners because we stock the state's largest inventory.
I'll take care of that.
We have the best skilled technicians.
I'll take care of that.
And we guarantee you're satisfied.
And I'll take care of that.
Call Middleton today.
Preparation and focus are important, but the best athletes know that winning depends on the ability to persevere. Our team of experienced trial lawyers at the Duncan firm has a track record of courtroom success. We know how to finish the race. If you've been badly injured on the road or on the job, put our experience and perseverance to work for you. Call the Duncan firm now at 8776-DUNCAN or visit DuncanFirm.com.
It's back and bigger than ever. America's largest spa dealer is having the world's biggest spa sale. Over 1,500 spas from 5 manufacturers at 12 locations. No games, no gimmicks. Higher quality spas, better service, and lower prices. It's time for a new spa. Up to 30% off all spas and swim spas. With over 50 models to choose from and hundreds of spas in stock, you owe it to yourself to check us out. Besides, don't you deserve it? World's biggest spa sale going on now at Family Leisure.
It's not what we ride that defines us. It's what happens along the way. We may not know where the ride will take us, but one thing's for sure. With the Law Tigers, you never ride alone. If you're injured in a motorcycle accident, call 1-800-LAW-TIGERS. Arkansas's motorcycle lawyers.
Hold on.
It just B-A-N-A-N-A-S.
Can you do it slow?
B-A-N-A-N-A. Banana.
Okay.
Bananas. S. Sonic Banana Pudding Shake.
Okay, great. I think that's right.
It is.
We'll have to check a dictionary.
I won the spelling bee.
Watch Laura Monteverde weeknights on KARK4 News. You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back into Capitol View. During an initial hearing, an Arkansas judge blocked the state from enforcing the law banning mask mandates by schools and any other governmental body. Now, Judge Tim Fox issued a preliminary injunction against the law that Governor Asa Hutchinson signed in April that bans mask requirements. That ban was being challenged by two lawsuits, one with two parents who are saying they have young kids who can't get vaccinated and want extra protection when they head back to school. The other from two school districts, one of the Marion School District, where the superintendent says more than 900 students and staff have had to quarantine. Now, one of those moms thrilled and relieved at the decision.
I know it's not finalized, but just to know that, you know, even the schools that have already started, that they're going to be able to get those children with masks on, and the schools that are going to start in a couple of weeks, that we're going to be able to have masks on those children, just is very, very exciting.
Now, Fox ruled against the ban on multiple grounds. One of the arguments says that it's discriminating between public and private schools. Both parents were happy to see something like this happen. Now, the Marion School District will take steps to see if they can vote and issue a mask mandate for their students and staff. Well, the special session was last week, and it had two specific calls on it, but it was dominated by trying to amend Act 1002 that prohibited masks in schools. Lawmakers took up two separate bills on the matter, at least on the House side. A second bill that was introduced by Representative Tippy McCullough, and it did not have any of the guardrails of schools wearing masks, but did add public-run daycares and open enrollment charter schools. Now, much of the testimony revolving around who should have the say on if kids wear masks or not.
It is time for our state leaders to set aside rhetoric, egos, and politics, and to do what is right for the public health of our citizens.
They are not your children. They are the parents' children. They are the students that you are charged with educating, and you're doing a lousy job.
Now, that bill did not pass on a voice vote. The committee then took up Representative Mayberry's amendments that lowered the cap to 21 days before a school board had to take up the issue again, and actually lowered the threshold to 30 cases per 10,000. That bill also did not pass. Now, the governor's saying he was disappointed with the legislature that they did not do anything to amend Act 1002. Now, on Friday, he held a press conference saying he regretted signing Act 1002 into law and says much of the legislature was cavalier and not compassionate about the issue.
What concerns me is that many are simply listening to the loudest voices and not standing up with compassion, common sense, and serious action.
One of the state's largest employers will require COVID-19 vaccines for their employees. Tyson Foods made the announcement after Walmart made a similar decision for its corporate employees last week. Our Will McClare spoke to an organization that advocates for poultry workers.
Springdale-based Tyson Foods now requiring all U.S. employees to be fully vaccinated by October 1st. The new mandate well received by Magalai Locoli, co-founder of Advocate Group, Vince Ramos.
I think overall, seeing how many workers have gotten sick, how many workers have died over the last year, the growing number of cases in these processing plants, I believe it's a responsibility.
With Arkansans testing positive, though, regardless of vaccination status, Locoli says more will need to be done to protect poultry employees.
Workers began to get sick at the plant because they were not reinforcing social distancing. They were not shutting down the plants to prevent more spread.
These measures have already been taken, according to Tyson. In a statement, the poultry giant said it has already spent more than $700 million on items like face shields and protective barriers to provide on-site testing and vaccinations. Despite this, Locoli says it's the employees who've paid the most.
Many workers got sick, many workers died, and many workers are still struggling with the finance situation, with the long side effect of COVID. They could have done way more than spending those millions of dollars.
With almost 50% of the U.S. workforce already fully vaccinated, Tyson says getting the rest of its employee base to get the shot will be vital to protect workers and ensure they can continue feeding our country.
Employees who are not vaccinated by the October 1st deadline will be fired without a severance package. However, the company's vaccination policy says it will accommodate religious and medical exemptions. Incentives will be offered to those who do comply. It was a homecoming fit for an Olympian. Arkansas's Kaylee Browning landed late last Tuesday night at Clinton National Airport. The international trap shooter came home with a silver medal. Our Hunter Hoagland talked to her right after she got off the plane. Take a listen.
Every time I look at it, I am reminded of all of the hard work that has gone into it for so many years. And I didn't just win this medal for me and my country. I won it for everybody that's here tonight, too.
You go, girl. Browning rode back to Greenbrier on a party bus with friends and family. The city had a homecoming celebration for her on Wednesday, and you can check out her full interview with Kaylee right now over on KARK.com. And we are back to wrap it up after this. You're watching Capitol View on Sunday morning.
It's back and bigger than ever. The world's biggest spa sale. 1,500 spas, 5 manufacturers, 12 locations. It's time for a new spa. Up to 30% off all spas and swim spas. Over 50 models to choose from and hundreds of spas in stock. World's biggest spa sale going on now at Family Leisure.
Injured? Let's talk about getting help now. Anywhere in the state, dial 8. Whether injured at night, on a weekend, or a holiday, anywhere in the state, dial 8. 888-8888. Let me say that again. Any place, anytime, anywhere in Arkansas, anywhere in the state, just dial 8. We're local lawyers, and it's a local number. Injured? Anywhere in the state, dial 8.
Summer clearance sale going on now at Family Leisure. Huge discounts store-wide. Pools, buy now and save. Patio furniture up to 50% off. Now is the time to buy. Great deals on in-stock spas. Deep discounts on swing sets. Summer clearance sale going on now at Family Leisure.
This is my house. My parents helped build it. Now we don't get wet when it rains. I don't get too hot or too cold inside. And I don't have to worry when the winds blow. This is my house. This is my house. This is my house. This is my house. My house. My house. I can play with my sister. I can play with my brother. I can play with my mother, my father, my family. My family. My family. This is my house. This is my house. I can study. I can be safe with my family. This is my house. This is my house. This is my house. This is my house. My house. My house.
This is my house.
Visit Habitat.org to find out how you can help more families like mine have a safe, decent place to call home.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
And that is it for this week's show. We're glad you came back. We're glad you held on through that Olympic spell here. We're going to have much more coming up next week. Our special thanks to Jesse Tenor and to Bo Ryall for joining us and shedding a little light on some things. That'll do it for this week. We will see you next Sunday.